imaging modalities that use for assessment of this system include ultrasonography, magnetic resonance imaging, computed tomography, and angiography. Regarding the anatomy, there are many structures and organs that uh, can be imaged by the different imaging modalities, and the reproductive system in male consists of many structures, and we are going to focus in some of these structures. As you know, there are two testicles provide within the scrotum and the epididymis, and this spermatic cord, and the prostate, and the penis. And we are going to focus on the testis and the epididymis and the prostate. This is a diagram illustrating the reproductive system in male, and this is also sagittal section, and also you can see the prostate and the epididymis that located within the scrotum, and this is the prostate at the base of the urinary bladder. So when we are going to assess the scrotum and its content, there are the ultrasound is the most common imaging modality that performed for assessment of the scrotum and its content, for assessment of the testis and the epididymis. But sometimes MRI may be used when the ultrasound result is inconclusive. The main indication for scrotal ultrasound include scrotal swelling and pain. These are the commonest indication for ultrasound: scrotal pain or scrotal swelling. In ultrasound, they may be a technique called Doppler ultrasound. When we say Doppler ultrasound, this means this is ultrasound in which we use a technique called Doppler for evaluation of the blood flow to assess the blood flow within the arteries and veins. So Doppler ultrasound can be used in case of patient presented with scrotal pain or scrotal swelling, because this scrotal pain and scrotal swelling may be due to very dangerous and very risky condition, which is testicular torsion. So to differentiate testicular torsion from the acute epididymitis or acute orchitis, you have to use this Doppler ultrasound to look for the blood flow. Is it impaired or not? If it is impaired, this means there is a testicular torsion. As we mentioned, MRI can be also used for assessment of the scrotal abnormalities, but usually we start with ultrasound, and if this ultrasound is inconclusive or provide insufficient information about the condition, in this time you can do MRI, but you have to use ultrasound for patient present with scrotal swelling and scrotal pain before MRI. Also, ultrasound can be used for searching for ectopic testis. Some patients present with empty scrotum. There is no testis within the scrotum. In this case, the testis may be arrested away from the scrotum, and this testis does not reach the scrotum. So you have to search for this testis. Sometimes it may be located within the abdomen or the inguinal canal or the perineal, according to. So ultrasound should be done for searching for these ectopic testes. If this ultrasound result is inconclusive, in this time also you can use MRI. So the next imaging technique for searching for the ectopic testes is MRI. The first one is ultrasound. For assessment of the testes, again we have to use Doppler ultrasound, because this color Doppler sonography provides simultaneous display of morphology and blood flow. This Doppler technique help us in assessment of the morphology of the testes and blood flow, because black and white ultrasound can be used for assessment of the morphology of the testes, but not blood flow. If we are interested in assessment of the blood flow, you have to add Doppler or use or perform Doppler sonography, not black and white or grayscale ultrasound. Normally, the blood flow can be detected with color Doppler and power Doppler. عندنا ultrasound عندنا can be divided into two parts. أول عندنا ultrasound ممكن تكون black and white يسموها شنو gray scale ultrasound or Doppler ultrasound. The black and white ultrasound or gray scale ultrasound can help us in assessment of the morphology of the structure. For example, these testes, but play nothing in assessment of blood flow. If we are interested in assessment of the blood flow, for example, to exclude testicular torsion, you have to use color Doppler. In color Doppler, there are two techniques. واحد يسموه power and the other يسموه color Doppler. This is a knob, يعني هي key. When we press the power key, in this time you can assess the blood flow, or you can press the color key to also to assess the blood flow. يعني إذا الباور دبلر and color دبلر technique الاثنين ديل هم شنو used by color Doppler sonography or ultrasound. In this image, you can see this is the testis and this is the epididymis surrounded by fluid, hydrocele, and this is the skin of the scrotum. If you look carefully, you can see the red color, and you can see also this box. In this time, this is a color Doppler ultrasound. Why? Because you can see the color box, and also you can see the blood flow, which evident by this color appearance. In black and white ultrasound, there is no color within the structure. But this color dots and lines indicate there is a blood flow, and this technique is color Doppler ultrasound, not black and white ultrasound. So ultrasound can be used for assessment of the testes. The testes normally appear as symmetric or void structure. This is a normal appearance of the testes, right testis and left testis. The testis normally, we have two testes. Both are symmetric and ovoid in shape and have a homogeneous and moderately echogenic pattern, homogeneous in texture with echogenic. Echogenic means يعني هي bright, يعني more bright. Echogenic pattern. The size of these testes equal 2/3/5 in the adult patient. This is a normal appearance. Symmetric, both testes are symmetric, ovoid structure with homogeneous texture, measuring 2/3/5. This is transverse ultrasound scan illustrates both, testes, right and left testes with characteristic and normal appearance. Also, this is ultrasound illustrates the testes, which is ovoid, homogeneous texture, and this is the epididymis. This is the epididymis. So this is a testis and this is epididymis in ultrasound. The epididymis consists of body, neck, and head. This is and tail. This is a epididymis. Also, this is a testis, and this is a epididymis. Look to the normal appearance of the testis. Echogenic, homogeneous in texture, or void in shape. This is ultrasound for the testis. Also, this is other image demonstrates the testes. This is a testis which appear homogeneous, echogenic, slightly echogenic, or void in texture. In this ultrasound, black and white. There is no color. Yani this is a black and white ultrasound, not colored double ultrasound. But this is a color double ultrasound. You can see the box. This is the box, and يعني البوكس ده هو عندنا knob or key. When we press it, this box. You can put the box in the area of interest, and then you can look to the blood flow. This is the normal blood flow, blue and a red color. This is color double ultrasound. In this one, you can see also this is a this is a doubler box, but there is no flow. But this is abnormal. ليش؟ لأنه there is no blood flow. لكن أهم شيء الآن لأن this is normal and this is abnormal. The technique is called for the study is color doubler ultrasound. Color doubler ultrasound. This is normal and this is abnormal because you can see the blood flow in the testes. Here there is no blood flow of the in the area of the testis. The next structure, reproductive system male structure we are going to talk about is prostate. Prostate is located in the base of the urea bladder. The best imaging technique for assessment of this prostate is transrectal ultrasound. Transrectal ultrasound is ultrasound done by insertion of the probe. عارفين عندنا البروب or transducer. This transducer can be, there are many transducers. Some of these transducer or probes can be used externally. The technologists put this probe on the anterior abdominal wall, on the pelvis, to look for the internal structure. But this is مثلا نسميها trans abdominal ultrasound. And sometimes we can do this by insertion of this probe, لكن ما عنده special designated probe. This probe can be inserted through the rectum for assessment of the prostate. So the best imaging technique for assessment of the prostate is called transrectal ultrasound, not transabdominal ultrasound, transrectal. Also, CT can be used for assessment of the prostate, but CT is poor for assessment of the prostate. Why? Because the zonal anatomy and pathology cannot be displayed well by this CT. It is poorly demonstrated by this CT. But CT can be helpful in assessment of the local extension of the malignancy, CA prostate, and also can demonstrate this lymphadenopathy and local invasion by the CA prostate. Lacking for the lesion itself, it's very poor for assessment of this area by CT. Magnetic resonance imaging, MRI, also can be used for assessment of the prostate, and it is very helpful in early stage of prostate cancer. And it can be also can be used for diagnosis of early prostate, and also can give us information about the extracapsular tumor spread, or secondary lymphadenopathy, metastatic lymphadenopathy. To conclude, this slide isn't the best imaging technique for assessment of the prostate, مثلا prostatic cancer or any other pathology, is transrectal ultrasound. نعرف معلومة إنه CT هي very poor for assessment of the prostate itself. ليش؟ لأن the zonal anatomy عارفين the prostate عندها peripheral zone central node zone are not displayed well by this CT. لكن CT is very helpful in assessment of the local spread of the cancer and for the lymphadenopathy. MRI very good for assessment and can detect even the early stage of the cancer. لكن احنا دائما بنعمل شنو transfector as the initial investigation. This is ultrasound for the assessment for the prostate. This is بنسميها transabdominal. This is urea bladder containing urine, and this is prostate. This is transabdominal ultrasound. But this is transrectal ultrasound, but this is the prostate. This is the prostate, and also this is the prostate. As we mentioned, CT can be used for assessment of the prostate, but it is very poor in displaying of the zonal anatomy, and differentiation between the peripheral and central zone of the prostate. The prostate on CT typically appear as ovular soft tissue density structure. As اللي هو ovular soft tissue. This is a soft tissue density. Soft tissue density. But CT يعني هي not good for differentiation of the prostate from the surrounding structure, surrounding fat and muscle, and in addition to differentiation between the different layers, central and peripheral zone. But this is CT. ليش قلنا CT? Because the bone, the pelvic bone appear very dense, the head of the femur and the pelvic bone, and this also always this is anterior and this is posterior, this is left and this is right. But this is the rectum posterior to the prostate. But this is the prostate and this is the rectum. But this is CT with contrast أو نسميه enhanced CT axial cut. Demonstrate the prostate and the rectum in this transverse section. We finish the male reproductive system imaging, and now we are going to jump to the female reproductive system. Also, the imaging modalities that commonly used for evaluation of the female reproductive system are ultrasonography, plain X-ray and fluoroscopy, plain X-ray or conventional X-ray and fluoroscopy. Fluoroscopy زي ما انتم عارفين هي ايش؟ هي light imaging technique in which you can commonly perform by giving the patient contrast and then look into the monitor or screen to look for the opacity of this contrast which given to the patient through any route and to evaluate this structure. This is fluoroscopy. CT scan of computed tomography, magnetic resonance imaging, and angiography. Also, ultrasound and CT and MRI have important role in assessment of gynecological disease. يعني احنا دائما بنعمل either ultrasound or CT or MRI. And in practice, usually we start with ultrasound for assessment of any gynecological abnormality. يعني إذا patient عنده مثلا patient presented with abortion or pelvic mass, ovarian mass, any gynecological abnormality, the initial investigation usually done is ultrasound. Accordingly, then we can request CT or MRI. So these are the commonest imaging modality performed for assessment of gynecological abnormality. For the obstetric case, ultrasound is used extensively. يعني لو حصلوا أي patient عندها pregnant lady followed by ultrasound during the antenatal care. من ما عرفنا أن patient is pregnant, then we follow her by ultrasound مثلا in the first trimester مثلا every week, in the second مثلا trimester every 2 weeks, and so on. But ultrasound is used extensively in assessment and follow up of the patient during the antenatal care. MRI we still used for evaluation of many gynecological malignancies and also benign conditions. يعني مثلا patient عندها suspected مثلا CA ovary or مثلا عندها patient present with fibroid is a benign condition. MRI can be used for evaluation of this condition. CT يعني not usually done for assessment for the gynecological يعني not commonly used for assessment of the gynecological abnormalities and usually reserved for the malignant diseases. لأن هي عندها play a very important role in assessment of the local invasion, especially the bone, and CT is the best imaging technique for assessment of the bone structure. By fluoroscopy in female reproductive system, we can do a technique that called hysterosalpingiography. Hysterosalpingiography. This is done by a fluoroscopy. And X-ray play a very limited role in assessment of the female reproductive system. But this is diagram illustrates the uterus, fundus, and the cervix and the vagina and the uterus connected in both sides by to the ovary by the fallopian tube. This is a fallopian tube, right fallopian tube and left fallopian tube. Please look to the distal end of the fallopian tube.
Doctor.
The end is free open into the peritoneal cavity. لاحظ إن the distal end of the fallopian tube this side or this point is open into the peritoneal cavity, and also this is the distal part of the fallopian tube. This is help us in understanding of the hysterosalpingiography. This is the vagina, and this is the cervix, and this is the body of the uterus. This is the sagittal section. Also, you can see the vagina and the cervix and the uterus, myometrium, and the endometrium in the center. And the urea bladder is anterior to the uterus, and the rectum is posterior to the uterus. The space between the rectum and the uterus is called Douglas of pouch, or cul-de-sac, or Douglas of pouch. This is a common site for accumulation of fluid or free fluid. طيب هنتكلم عن hysterosalpingiography. This is hysterosalpingiography is the imaging technique performed in selected cases of infertility for what? For assessment of the patency of the fallopian tube. And I think one of the causes of infertility is blockage or obstructed tube. لأن the ovum اللي هي بيحصل لها شنو؟ travel through this fallopian tube. If it is blocked, there is no chance for pregnancy. In case of infertility, it is very important to assess this fallopian tube. Is it patent or not? But this is done by hysterosalpingiography. This technique is done by injection of contrast, iodinated contrast, or water-soluble contrast media, by a catheter or a cannula. This is a cannula of catheter inserted into the external uterine os, and then we inject a contrast. Contrast first fills the cavity of the uterus, then go to fill the post-fallopian tube in both sides. And then if the tube is open, not obstructed, the contrast is filled into the uterine cavity. زي ما تذكرت وقلت لكم look to the distal part of the fallopian tube بتكون free open. فإذا هي ما في blockage, فإذا the contrast then is filled into the peritoneal cavity زي دي. This is normal hysterosalpingogram. ليش؟ لأنه the tube can see the contrast objectifies the tube. This is the tube, and you can see the contrast clearly spilling to the uterine cavity. This indicating there is no blockage. These fallopian tubes are patent when there is a free spill of the contrast into the peritoneum cavity. So this is hysterosalpingogram. This is a catheter or tube اللي هي بتكون connected to the syringe containing contrast. Then we inject the contrast to perform this technique or study. فمثلا عندنا هنا this is a catheter or sometimes نعمل catheter أو شنو cannula inserted to the external uterine os. Then the contrast first filling the uterine cavity, and next the contrast go through the post-fallopian tube. If these tubes are open, the contrast will be seen clearly into the peritoneal cavity. This is a study of the hysterosalpingogram. So hysterosalpingogram is a radiologic method for assessing of tubal patency. لاحظ انه by CT or MRI, this technique are not helping us in assessment of patency of the fallopian tube. The indication, and many indications, like the most important are infertility. And this is the most common indication for assessment of the patency of the fallopian tube, or in case of recurrent viscosities, or to look for the shape or configuration of the uterus to exclude congenital uterine anomalies. There are many congenital uterine anomalies, bicornuate, tuplate, and unicornuate, and there are this can be hysterosalpingogram can be used for assessment of this congenital anomaly, or any uterine tubes pathologist ممكن تكون tumor or stricture or adhesion مثلا عملية obstruction or blockage. The contraindication if there is a recent history of surgery. يعني the patient مثلا كانت within مثلا 2 weeks كان عندها history of surgery on the tube. يعني مثلا إن شاء الله عملنا laparoscopic for the tube or any other surgery in the tube. This is a contraindication for this hysterosalpingogram. for يعني for not يعني absolutely contraindicated for a time. يعني you can postpone this technique يعني after مثلا 1 or 2 months, or also if there is a surgery in the uterus, any surgery ممكن يكون مثلا even DNC or مثلا patient after abortion, or in patient with acute or subacute pelvic inflammatory disease إذا كان عندنا severe infection, because لأنه دي كان تعمل لنا شنو ascending شنو infection. إذا كان عندنا البيشنت عنده severe PID or pelvic inflammatory disease, this is also contraindicated. You have to treat the patient by مثلا antibiotic, and then you can do this hysterosalpingogram. Contrast allergy, although it is not common, يعني هي ما قاعد نشوف كثير. If the patient have very عنده contrast allergy, this is also contraindicated. The last one is very important: pregnancy. If the patient suspected pregnancy, this is absolutely contraindicated. لذلك احنا دائما this technique done in the first 10 days of from the first day of the menstrual cycle to avoid the chance of pregnancy. لكن إذا في any chance of pregnancy, this is you have to be sure by also you can do ultrasound, you can do urine for pregnancy test, or you can do beta HCG for يعني you have to be sure that there is no pregnancy. لذلك احنا زي ما قلنا لكم بنبدا دائما نعمل within the first 10 day يعني بسموها safe day دي. Complication هي not common, لكن the patient may complain of pain according to يعني ممكن يكون mild pain to severe, لكن usually there is a mild pain, bleeding, although it is not common. Infection sometimes can be occurs and contrast media reaction. So this is what is this imaging technique or imaging study? This is for you. Yes. What is this imaging study or imaging technique? Any volunteer?
Hysterosalpingogram.
يقول hysterosalpingogram لكن لأن واحد to or any student to explain the anatomy. And you want to explain the anatomy, which is this and what is this? What is this? Yes.
This is the uterus and fallopian tube.
Right. This is a cannula or catheter which you put in the external uterine fossa. That is the contrast specifies the uterine cavity, the right fallopian tube and the left fallopian tube. And there is a clear scale of contrast. But this is normal hysterosalpingogram. Also, this is normal. You can see the cannula and the contrast specifies the uterine cavity. No, there is no filling defect. And you can see the contrast in both fallopian tube on both sides with free spill of contrast in the peritoneal cavity. Also, this is a right normal hysterosalpingogram. Ultrasound دايما احنا male قلنا عندنا transabdominal ultrasound and transrectal ultrasound. In female, the ultrasound can be done through the anterior abdominal wall, transabdominal ultrasound, and also it can be done by transvaginal technique by insertion of the special designated probe through the vagina for assessment of the pelvic organ, for assessment of the uterus and ovaries. So transabdominal ultrasound technique is can display the wide field of view. يعني لما نعمل transabdominal ultrasound, you can see the uterus and the both ovaries and give us wide field of view. To do this transabdominal ultrasound, the patient should be full bladder. يعني ليش نحن this patient should be full bladder? Because we use this full bladder which containing urine as a window to look for the uterus. يعني البيشنت إذا كان empty bladder, very difficult to visualize the pelvic organ, the uterus and the ovary. So it is mandatory to ask the patient to be full bladder, to use this full bladder as a window to look behind it to the uterus and the ovary. In transvaginal ultrasound, the patient should be empty bladder. Or sometimes we can need, very small amount of urine because we can use this for, as a reference for the anatomical reference. يعني. لكن the patient should should evacuate her bladder. And transvaginal طبعا هي عندها good quality image. حتى الspatial resolution and contrast resolution يكون very clear. You can look to the يعني حتى very small lesion can be detected by transvaginal ultrasound. So ultrasound either transabdominal or transvaginal can be used for assessment of the uterus, cervix, and vagina and ovary. This is transabdominal ultrasound. ليش? Because you can see the bladder containing urine. Urine is anechoic, black, and this urine used as a window to look for this structure. If the patient is empty bladder, it is difficult to see this structure, the uterus and even the ovary. So this is transabdominal ultrasound. This is the urine within the urea bladder, and this is the uterus in sagittal or longitudinal view. This is the vagina, and this is the cervix. This is the uterus, fundus of the uterus. This is the myometrium, and this also myometrium in the center. The central part, this is the endometrium, which appear as hyperechoid. Endometrium appear hyperechoid, and this is the myometrium, and this is myometrium in this longitudinal ultrasound scan. Again, this is a uterus. كله كده is a uterus. إذا سألنا عن الأودين this is a myometrium and this is myometrium. كله كده uterus. This is a myometrium and endometrium in the center, and this is the cervix, and this is the vagina. This is the axial or cross section. لاحظ إنه also the urea bladder full of urine. This is the uterus. Lateral to the uterus there are two ovary, right ovary and left ovary, and this is the uterus, and this is the endometrium. This is axial, like this is longitudinal or sagittal. Right. For the what the normal appearance of the ovary. نعرف إنه this is normal ovary or not. And we have two ovaries. The normal appearance of the ovary on ultrasound appear similar to this. لاحظوا إن here the central part is echogenic pride. The central part is echogenic, stroma. Central echogenic stroma is echogenic. Then in the peripheral of the ovary, you can see there are multiple anechoic, as well. Flat structure, these follicles. Size بتاعها usually range between 3 to 4 millimeters. But this is normal appearance, and this is a hyperechoic دي بنسميها panica. فإذا this is the stroma, and these are the follicles. These are the follicles are distributed in the periphery, and this is a tanica. أهم شيء نعرف إنه this is the normal. The center بيكون echogenic or pride. In the periphery there is multiple follicles. ممكن تلقى 1 2 3 4 up to 12. فلكن لاحظ إن هي small follicles range between 3 to 4 millimeters. طيب this is in adult. In post-menopausal طبعا بيحصل atrophy of this ovary. So in postmenopausal women, the ovary appear small in size and appear more echogenic, more hypoechoic. And here كانت echogenic, here more hypoechoic. And they may be cysts or follicle, small cysts or not. So مثلا هنا there is one أو ممكن تلقاهم multiple in this appearance of ovary in postmenopausal. طيب the other structure تكلمنا عن uterus, then on the ovary. طيب fallopian tube. What about the fallopian tube? Normally fallopian tube not seen by ultrasound unless this tube is dilated. إذا كان fallopian tube dilated fallopian tube بنسميه hydrosalpinx. If the fallopian tube is dilated, it can be seen by ultrasound, but normally this fallopian tube is not displayed by ultrasound. Also, this fallopian tube may be seen if there is a cyclist, the capillary fluid ascites. Also, you can see the fallopian tube floating on this fluid. And as you know, this fallopian tube connected to the uterus. The normal fallopian tube is not seen, and in what conditions this fallopian tube may be seen in case of hydrosalpinx or ascites. The appearance of the uterus change with menstrual cycle. أول شيء إحنا زي ما تكلمنا إنه the central part is endometrium, بيكون hyperechoic and this is the myometrium in both sides. The myometrium بيكون يعني hypoechoic لكن السنترال بارت الاندوميتريوم بيكون شنو hyperechoic echogenic يعني وهو شنو linear stripe. This linear hyperechoic, this is the endometrium, and this is a hypoechoic is myometrium in both sides. But what are the normal features of the uterus according to the cycle, or of the endometrium according to the cycle? But in the menstrual phase, the endometrium لاحظوا نقول endometrium هو اللي center ضيق اللي هو dividing the myometrium or between the both myometrium. But look to the endometrium in this early menstrual phase ultrasound. You can see this myometrium is hyperechoic, very thin hyperechoic. This is in the menstrual phase. In follicular phase, the shape of the myometrium is trilaminar and 1, 2, 3 laminar. فإذا كان عندك appearance دي بتعرف إنه this is in the follicular phase of the menstrual cycle. In the ovulatory phase, the myometrium is hyperechoic, like it becomes thick compared to the other phase. لاحظوا إنه هو hyperechoic but thick. In the luteal phase, the myometrium also hyperechoic but very thick. There is increased thickness of the myometrium. So this is the appearance of endometrium according to the menstrual cycle. طيب نجي للnext structure اللي هو هيكون شنو؟ the cervix. Fluid in the cervical canal. طبعا this is مثلا fluid دائما in ultrasound بتكون شنو؟ plaque anechoic. This is the fluid into within the endocervical canal. بتكون شنو؟ anechoic. This may be sometimes seen normally يعني in the مثلا during the menstrual cycle or after delivery, or it can be seen normally this fluid in the cervical canal. طيب عندنا the fluid also can be accumulated in the Douglas of pouch or rectouterine space. Rectouterine space, this is fluid. This fluid can be, if it is minimal, it can be normal. It's a more physiological accumulation of fluid in the Douglas of pouch. Here can be seen in the during the menstruation, during the menstruation, or peri-ovulatory phase, and also in the in the early pregnancy. But this is physiological fluid in the pouch of Douglas. لكن عندنا pathological هي ممكن تكون due to مثلا pelvic inflammatory disease. Pelvic inflammatory disease برضه characterized by fluid in the cul-de-sac portion of pouch of Douglas. لكن نعرف what are the physiological causes of these free fluid in pouch of Douglas. طيب ده نتكلم عن نعيد يعني anatomy of the female reproductive system, especially the uterus and ovary. But this is transabdominal ultrasound. من نشوف الفلويد during in the urinary bladder تعرف transabdominal ultrasound, longitudinal or sagittal. But this is the vagina. Here, from here to here, this is the cervix, and this is the body of the uterus. Myometrium in both sides and endometrium in the center. This is also transabdominal ultrasound, uterus and the right ovary, central stroma, peripheral follicles. This is transvaginal ultrasound. لاحظوا إنه there is no urinary bladder containing fluid. This is transvaginal with the feature of the ovary. There's the ovary, the central stroma, which is echogenic, with peripheral located follicles, small follicles, and the peripheral tentacle, the hyperechoic and also the vaginal ultrasound This is the follicles, reproduced and the central, is trauma. Now we're going to talk briefly about the assessment of the gestational age. Obstetric in the first trimester we after مثلا patient هي إنها كانت مثلا عندها amenorrhea مثلا for مثلا 6 months, we have to assess the age of this pregnancy. طيب نحن أول شيء البيشنت ممكن يكون نعمل لها شنو؟ serum beta HCG. If it is positive معناتها البيشنت ممكن تكون pregnant. So we have to confirm this pregnancy by ultrasound. دائما بنعمل ultrasound. The first sign of pregnancy is presence of this sac. شنو؟ York sac. The York gestational sac. Sorry, this gestational sac. This is the first sign of pregnancy. أول شيء علامة بتصل من pregnancy by ultrasound is this sac containing fluid يسموها شنو؟ gestational sac. Then within this sac, then develop York sac. This is a small sac within the gestational sac. This is called the York sac. Then the embryo. But this is the embryo. But this is the how the the pregnancy is progressed. فأهم شيء نحن عملنا البيشنت كان suspected pregnancy بعد لأنها كان عندها amenorrhea عندها serum beta HCG is positive عملنا ultrasound. You have to measure or assess the gestational age by measuring the diameter. بنعمل 3 diameter نسميها mean sac diameter. The machine calculates this measurement and into weeks. هتقول لك مثلا this is 4 weeks pregnancy. فإذا this is the gestational sac can be visible at 4 to 5 weeks by transvaginal ultrasound. ممكن نعمل transvaginal ultrasound أو نعمل transabdominal ultrasound. لكن by transabdominal ultrasound this gestational sac seen later يعني إلا في شنو in week 6. لكن by transvaginal لأن transvaginal قلنا very sensitive and the contrast resolution and image quality is يعني is very is superior than transabdominal. لذلك إنه can detect this gestational sac within 4 to 5 weeks. طيب طبعا ال pregnancy progress then the embryo can very small like this يحصل له cross and development تبقى زي دي. this is مثلا this is the intrauterine pregnancy. This is the head of the fetus. This is the spine, the back, and this is the abdomen, chest. This is the mouth, face of the and this is the limbs. This is the placenta. But in this time, we can assess the gestational age by other method. This is called crown rum length by measuring the full length of the fetus from the bottom to the top of the head. But this is طبعا بنعمل measurement of the machine طوال تقول لك إنه this is مثلا 9 weeks gestational age. Then this is the other method for estimation of gestational age. Then the fetus develop within the uterus. بعدها ممكن نعمل this technique يسموه biparietal diameter. This is the head of the fetus. We can measure the this diameter from the outer table to the inner table, and the machine calculates this distance into weeks. ممكن نقول لك مثلا this is the 28 weeks, and this is biparietal diameter. Then after يعني late pregnancy we can assess the gestational age by this technique بيسموه femur length by measuring the length of the femur. This is the femur of the fetus, and we measure this distance, and the machine this is the 34 week gestational age. Then all these بيسموها methods ultrasonographic methods for assessment of the gestational age. The most accurate one is crown rump. يعني دائما حتى إذا كان البيشنت uncertain of her date يعني she does not know when her last menstrual period كانت متى دائما إذا كان عمل ultrasound in the early ultrasound, this is the most accurate and reliable measurement round rumblings. الآن نتكلم قليلا عن one of the methods of the family planning. عندنا IUCD intrauterine contraceptive device is a method for pregnancy control or family planning, and sometimes this IUCD can be lost. يعني not common, like it can be lost, but the imaging play a very important role in localization of this, IUCD. Right, in the suspected lost intrauterine contraceptive device, the ultrasound should be done first. The initial investigation for searching for IUCD is ultrasound. لاحظوا إنه the appearance of the IUCD appear as echogenic and bright linear structure. أو هنا طبعا لأنه هو ما شكله زي T. But this is a linear echogenic structure. This is IUCD. The IUCD can be located in the pelvis, in the uterus by the IUCD. طيب, if this IUCD does not located by the ultrasound, what next imaging technique should be requested? This the plain field, plain X-ray is the next imaging technique should be done for localization of IUCD. But this is plain X-ray. This is plain X-ray or plain radiograph for the abdomen. احنا ما عارفين الاي سي دي ده هو وين، ممكن يحصل له مرات يحصل perforation for the uterus تلقاه within the abdomen. But this is مثلا الآن the IUCD appear as opaque. This is IUCD in plain X-ray. Like this is ultrasound. This is the head of the fetus, and this is ultrasound. Illustrates this, intrauterine pregnancy with the back or the spine, the head, and the lower limbs. Like CT. طبعا احنا قلنا can be used for gynecological abnormality, not for the obstetric condition. This CT used to see calcification. مثلا patient عندها leiomyoma or fibroid. طبعا اكس راي برضه كان demonstrate this calcification. And CT يعني both CT and X-ray plain X-ray can be used for demonstration of this calcification. طيب the technique for CT احيانا ممكن نعمل CT without contrast يسموها non contrast CT or CT with contrast يسموها contrast enhanced CT. And CT يعني is recommended to be with partially distended urea bladder. يعني زي ما قلنا تكون شو كأنها زي landmark. طيب إذا بدنا نعمل contrast enhanced CT بنعطي البيشنت شنو contrast intravenously, because this contrast help us in differentiation between the vessels and lymph nodes and the pelvic structure. يعني احنا عارفين الفازل enhanced with contrast, lymph node يعني ما بتكون enhancing accord with other structure according is it if it is normal مع enhancement. If there is a muscle lesion sometimes can take the contrast. المهم احنا بنستخدم contrast to differentiate between the normal from the abnormal structure, or to differentiate between the vessels from the lymph node and the normal structure and the lesion. طبعا احيانا بنعطي البيشنت oral contrast. oral معك هياخده عن طريق the mouth, and then contrast go through the stomach or bowel. Then this contrast within the bowel help us in differentiation of bowel from the pelvic structure, especially the adenexial. يعني إذا عندنا مثلا adenexial tumor أو any pathology in the adnexia, if the patient did not receive oral contrast, الاناتومي يكون very يعني not clear. يعني ما بتعرف إنه this is bowel or this is adnexia. So it is recommended to give the patient oral contrast to obesify the bowel, and this help us in differentiation of this bowel from the adnexia. So what is this imaging technique in a volunteer? Is this X-ray, ultrasound, CT, MRI?
CT.
CT.
Do you hear me?
Yes, doctor.
سامعني طيب يا شباب؟ عشان أنا شكيت إنه
Yes, doctor.
صوتي ما واضح.
Yes. هو ما يسمعنا.
سامعني؟ صوت واضح؟
دكتور. دكتور.
Okay. Right. This is
Doctor, we
axial
can hear you, doctor.
CT. ليش CT؟ لأنه قلنا to differentiate between C and other modality, look to the bone. This is forehead very dense. This is anterior. This is always anterior, and this is always posterior, and this is the left, and this is right. This is urea bladder. Posterior to this urea bladder is the uterus. So this is normal uterus. This urea bladder, and this is the uterus in this axial CT. زي ما اتكلمنا عدة مرات إنه CT can be reconstructed into coronal and sagittal. But this is CT reconstruction at the level of the mid-sagittal D, at the level of the uterus. But this is the spine. This is posterior, and this is anterior, and this is the uterus. This is the endometrium. This is the endometrium, and this is the myometrium, both sides. And this is the cervix, and then the vagina. This is a sagittal reconstruction CT. لاحظ انه اذا ما حطينا البيشنت شنو oral contrast اذا في abnormality in the مثلا adnexal tumor or مثلا any abnormality adnexal hydrocele salvings or خلينا نقول any مثلا ovarian or tubular abnormality يكون دائما difficult to be differentiated. لذلك oral contrast is very important. This is MRI sagittal. MRI sagittal. This is a posterior, this is a spine, and this is anterior. This is urea bladder. This is MRI T2 ليش؟ and the fluid, when the fluid is bright, hyper intense, this is T2. This is the urea bladder, sagittal MRI T2. In the center, you can see the endometrium and the myometrium in both sides. Myometrium, this is endometrium hyper intense, and this is the cervix, and this is the vagina. Posterior to the uterus is the rectum, anterior is the uterus. Is an MRI can demonstrate the uterus, and is a very excellent and very good imaging technique for demonstration of the uterus, as the uterus is the soft tissue. عارفين the MRI is the superior imaging technique in demonstration of some soft tissue. لذلك you can see the different layers, the endometrium very clear, and also on MRI you can see the ovaries. بس عندي sagittal ovaries ما واضحة، لكن تكون واضحة in the شنو corona or axial. Also this is MRI sagittal uterus. كل uterus كده البادي fundus and body, and the cervix and the vagina. The urea bladder anterior, rectum is posterior, the spine is also posterior, the endometrium, myometrium both sides. This is CT. ليش؟ لأنه لاحظ إنه هنا الكون appear black or يعني gray according to the sequence، لكن ما بكون مرة bright. This is CT axial. This is urea bladder, and this is the uterus and this is a rectum posterior. This is anterior and this is posterior. This is MRI coronal. This is urea bladder, and this is a uterus. لاحظوا endometrium. This is MRI T2 lateral fluid pride hyperintense of high signal يعني. لاحظوا إنه برضه البون ما بكون أبيض زي دي not very dense. This is MRI. This is a ovary on both sides. لاحظوا الفوليكلز اللي كان شفناه in ultrasound. This is the follicles arranged in the periphery. This is the left ovary and this is the right ovary. Also, this is the left side and this is the right side. This is the endometrium, the center, and myometrium. We need one of you to answer my question in this last slide. Any volunteer? Start with this one. What is the imaging technique?
ultrasound.
ultrasound.
Can write on the chat.
دكتور تسمعنا ولا لا؟
Yes. كان أتكلم الصوت ما واضح عندي يعني.
دكتور يا جماعة أحد يكتب له، ترى هو كاتم الصوت من تحت، شوفوا الشاشة حقته.
طيب أنا ما أعرف ليش. طيب أوكي. طيب sorry شغلت كان أمر مني يعني. This is ultrasound sagittal or longitudinal transabdominal, not transvaginal. This is urea bladder containing urine, anechoic. This is the uterus. This is the uterus. And this is the fundus and this is the body. And this is the cervix. The cervix. And this is the vagina. Concerning the layer, this is the endometrium. And this is the myometrium. And this is the myometrium. This is MRI T2. Urine appear hyperintense pride, sagittal. This is the endometrium. And this is the myometrium. Regarding the layers, regarding the structure, this is the uterus. This is the cervix of the uterus. From here, this is the vagina. This is trans-abdominal ultrasound for pregnant lady. You can see the fetus in the uterus. This is the amniotic fluid. أي fluid ultrasound بيكون anechoic. And this is the placenta. And this method is called crown rump length, measuring the distance for estimation of the gestational age. This is hysterosalpingography. Hysterosalpingogram or hysterosalpingography. The anatomy is this is a cannula or catheter. They try in cavity or the uterus. Fallopian tube on both sides, right fallopian and left fallopian tube. الباقي ده كله contrast spin. This is normal, age history. Do you have any question? If you have any question, you can.
دكتور
Question? Yes.
Doctor, you can hear us or no?
Yes. Do you have any question?
دكتور.
يس كده انا اسمعكم، كنت كان ميوتد فعلا. يس. اوكي سوري. Do you have any question or any comment?
Yes, doctor, I have a question.
Yes, welcome.
دكتور، المحاضرة هذه بتكون معانا في الأوسبي بس ولا أوسبي وفاينل؟
This OSPE and final. This is for final. For the OSPE, we have a file for the OSPE. I can discuss it with you after this if you want.
Yes, we would like to do so now.
Yes. Okay. But concerning the lecture, do you have any question concerning this? Do you have any question in this? Yes?
No, thank you, Doctor.
Yes. Here, you got it. If there is any slide not clear or any point need more explanation, feel free to ask. To have no, can come to the OSPE file. Okay.
Doctor,
Yes.
I have
Yes. You have question. Yes. The voice is not clear. Yes. If you have a problem with your microphone or and if you can write into the chat.
Doctor, can we leave?
Yes, we can. Quite نبتدي في الأوسبي باي.
Yes, Doctor, we would like to take the OSPE now.
Okay. Right. This slide, the question may be about the imaging modality or imaging study. The difference between the imaging modality and imaging study, and sometimes maybe imaging exam. Imaging modality means MRI, CT, conventional X-ray or plain X-ray, fluoroscopy. The technique or the machine that used for doing this image. But the study or the exam, in addition to the imaging modality, you have to mention the structure or the imaging part. So, for example, in this question, if we ask about the imaging modality, you can write ultrasound because this is imaging modality. Study ممكن تكون شنو double ultrasound for the double ultrasound for the scrotum or for the testes or upright. إذا this imaging modality is ultrasound. Imaging study تكون لازم تكون doubler لأنه إذا قلنا imaging modality ultrasound is imaging modality لكن study doubler ultrasound for the scrotum or for the testes. The anatomy, this is the testis and this is the epididymis. This is epididymis and this is the testis.
Doctor, the study of the term of the exam.
Yes?
When you ask imaging the study or imaging exam, it's the same?
It may be imaging modality. The question may be imaging modality or imaging study. If the question is imaging modality, just write ultrasound. If imaging study, doubler ultrasound, scrotal or testis. You got it?
Yeah, thank you.
Give the name of the used imaging modality in the given image.
Ultrasound.
Yes, US ultrasound. Abbreviation is it written right? Okay. Give one indication for this imaging examination. This is upon question. That is the commonest indication.
Swelling and pain.
As swelling, pain. ده المكتوبات عندكم حتى لو جبت مثلا suspected hydrocephalus there are many indications لكن the commonest indication طبعا شنو scrotal swelling on scrotal pain. What is this or this?
Testis.
Yes. The imaging modality in this one?
Ultrasound.
Yes. This A point to which structure? And this structure.
Epididymis.
Epididymis. What is this?
Testis.
Testis. Also, this is the ultrasound, testis, and epididymis. Right. This is a patient that presented with scrotal pain, or ممكن يقول لك with a scrotal swelling. If the question, what is give the name of the imaging modality, what will be your answer? Imaging modality. Ultrasound. If the question,
Color Doppler.
yes, if the question about the imaging study or imaging examination, color Doppler or the scrotum or testis. Color Doppler. إذا لاحظوا إن إذا كان موداليتي التراساوند عندي بسموها موداليتي اللي هو المشيرة اللي عملنا بها التكنيك لكن the study هي color doubler for the testis. Give the name of the label male organ. This. What is this? The testis. Yes. طيب احنا طبعا اذا جبنا لك بيشنت بريزنت ويز سكروتال بين ما هنقول لك هنا ميل. انا مرات بجيب منه مثلا اقول لك جيب ذا نيم اوف ذا ليبل ميل لكن ما بكون جبت لك الهنت دي. لكن اذا قلنا لك بيشنت بريزنت ويز سكروتال بين هتعرف انه ذيس از ذا ميل بيشنت وذيس از ذا سكروتال هتعرف انه ذيس از ذا ما بنقول لك ميل. فهنقول لك جيب ذا نيم اوف ذا ليبل اورجان مارك اس بي ذيس از ذا testis. Give the name of the imaging modality in this one.
Ultrasound.
Yes. Give the name of the imaging examination or study.
Doctor,
uh,
in the previous slide,
transabdominal.
Yes, sorry, how we are going to go back to
the imaging modality is only ultrasound
yes,
or color Doppler ultrasound.
only ultrasound. Color double ultrasound for the imaging study. لكن هي modality ultrasound the machine. Like the name, as your colleague said, this is a ultrasound, the imaging modality ultrasound. But for the imaging study or imaging exam, what is your answer?
Transabdominal.
Transabdominal ultrasound for the
Prostate.
prostate or for pelvis. For right, and عملناه for the pelvis or for the prostate.
pelvis أو prostate كلهم صح.
Yes. The imaging modality in this one,
ultrasound.
the imaging study or imaging examination,
Transrectal.
transrectal ultrasound. Very good. What is this structure? Mark as A. This
Prostate.
prostate. And what is this?
Bladder.
Bladder. طبعا ما حنتأكد منها لأنه إحنا in reproductive system لكن bladder. And what is this? A. Also, this is a prostate. Like, gives the name of the used imaging modality.
CT.
Why CT?
MRI صح؟
Yeah, CT. أنا بدي أتأكد إنه ليش هيك قال CT. You are right. CT. Yes. عشان تعرف إنه CT look to the bone. أصلاً ما في bone بكون bright إلا في CT. يعني MRI طبعاً إحنا عندنا مشكلة في الفيشيات between CT and MRI. Look to the bone. Bone CT very dense, very bright. So this is a CT. What is this structure? Yes, there. And what is this? فنلاحظ انه قلنا لك ميل عشان تعرف انه مثلا this is a pelvis و this is a شنو لانه ممكن يكون يعني اليوترس والبروستات قريبات لبعض في الشكل يعني كروس سكشنال او سي تي يعني فدي هي هنقول لك ميل عشان تعرف ان this is a prostate this is CT. Concerning the female reproductive system, the imaging study or imaging examination.
دكتور ايش الفرق
ايش
بين الايمجنج موداليتي والاكزامينيشن او الستدي؟
examination. طيب الحين مثلا هسه اذا سالناك of imaging modality in this one هتكون ايش؟ what is your answer? imaging modality يعني اللي هو
CT?
no CT. yes this is fluoroscopy يعني عملناه بالفلوروسكوبي الجهاز اللي اتعمل به هو فلوروسكوبي لكن imaging examination is HSD او ممكن تكون imaging study is HSD. بل لما نقول modality مقصود به the machine that used for performing the exam, the imaging exam. إذا كيف تكون CT or MRI or conventional X-ray أو plain X-ray أو fluoroscopy دي الأجهزة اللي بنعمل بها التكنيك دي. This is a hysterosalpingogram or HSG. What is this? Or the C point.
Left fallopian tube.
Left fallopian tube. The P.
Left fallopian tube. Right fallopian tube.
Right fallopian tube. Yes, this structure.
Uterus.
The uterus. لاحظ إن الكونتراست this is normal and contrast clearly spilled تدفق بحرية تامة لأنه this there is no blood this is normal. Then the imaging examination is hysterosalpingogram or HSG. So give one indication for this study.
Infertility.
Yes, it's the most common. And give one contraindication for this.
Pregnancy.
Yes, pregnancy. Thank you. Very good. The patient presented with vaginal bleeding. ليش؟ عشان نعرف إن this is female يعني. يعني this is hint for you إن this is a female يعني. What is the imaging modality?
Ultrasound.
What is the imaging study? نقول ultrasound for female either what or either what? I think the technique ده بيقعد عامل كده.
Transverse.
Yes, but this is transabdominal. You can see the urea bladder full of urine, but this is a cancer study or examination هتكون transabdominal ultrasound. Modality is ultrasound, just ultrasound. Give the name of the label organ. إذا قلنا organ هنكون عن الليب بس organ. لاحظوا إنه قلنا organ, but this is not what is a organ.
Endometrium.
organ
Uterus.
uterus. لكن إذا كان سألنا عن layer uterine layers معناتها دايرين هي is it endometrium or myometrium?
Endometrium. Myometrium.
Yes, this is B. B is what?
Myometrium.
And A is
Endometrium.
طيب ما حنسألكم من الديتيلز يعني vagina, cervix and fundus يعني the organ معناتها حيكون uterus. إذا كان سألنا الlayers تكون عارفين الأشياء شنو endometrium and myometrium. endometrium the center يكون hyperechoic أبيض حتى في الMRI يتذكروا إنه أبيض برضه. هنا بسموه hyperechoic on ultrasound بسموه hyper intense. Female patient present with history of infertility. The imaging modality is
Ultrasound.
ultrasound. Gives the name of the label organ. What is this organ?
Ovary.
Ovary. The details طبعا تعرفوها لكن الآن ما حنتأكد منها لكن this is the stroma and these are follicles arranged in the periphery of the ovary. This patient present with amenorrhea, cessation of the cycle, or patient present with serum beta HCG positive. لما نقول serum beta HCG is positive معناتها البيشنت دي هي يعني suspected to be pregnant. يعني positive HCG معناتها البيشنت دي pregnant. يعني تتذكروا this إنه إذا البيشنت كان عندها HCG positive معناتها هي this is a positive test for the pregnancy. The imaging modality here.
Ultrasound.
Yes, methods of estimation of gestational age is this one.
ARL.
Mean sac diameter. Yes, mean sac diameter. What is this structure called? This one. Gestational sac. And what is this? انتوا حمستوني انا هسألكم اسئله زياده ما شاء الله. What is this?
Embryo or
something? Yes, this is your sac. And what is this? The embryo. Yes, يعني الامبريو بيبدأ كده يكون زي دي حتى ممكن إذا عملنا دبلر تلقى الهارت بيتنج. يعني دي تكون very small زي دي في early pregnancy. بعد ذلك بيحصل له cross on development. Then بيحصل له formation of the organs and structure. طيب what is the imaging modality in this one?
Ultrasound.
What is the methods of estimation of gestational age?
Crown rump.
This is crown rump length. بنعمل measurement from here to here. So this is the crown rump length. The imaging modality.
Ultrasound.
هنقول لك pregnant late عشان تعرف إنه this is the يعني intrauterine pregnancy organs or structure. But this is the head of the fetus. But this is the ultrasound. The methods of estimation of gestational age in this image.
BPD.
parietal diameter.
أيوة باي parietal diameter. Pi 2 parietal. This is one parietal and this is the other parietal bone diameter. Pi parietal diameter. Also, this is the pregnant lady. The imaging modality.
Ultrasound.
What is this? This is a femur, and the method of estimation of gestation age is age femur length. لكن this is the femur of the fetus. عملنا التكنيك اللي اسمه femur length by measuring the distance from the 2 points of the femur. But this is femur length. The patient present after 2 weeks of family planning مثلا أو 1 month. من family planning كان تعرف إنه there is a we use methods of family planning. But what is the imaging technique? Ultrasound.
Ultrasound.
What is the name of the label device marked with as A? IUCD. What is IUCD? IUCD stand for what? IUCD. Yes, thank you. Clarifying contraceptive device. And also, this is ultrasound. Instead, IUCD, intrauterine contraceptive device. The modality is ultrasound. So, what is the imaging modality?
X-ray.
X-ray or plain X-ray or X-ray or radiograph. Like, what is the imaging study? For which part?
IUCD.
The imaging study.
Pelvis.
Pelvis only?
Abdominal.
Yes, this is abdominal what? بس حنضيف بدل نقول إنها قلنا إذا كانت imaging modality بتكون plain X-ray نقول abdominal plain X-ray or abdominal radiograph. يعني كلمة study in addition to the technique أو the modality you add the imaging part. So this is a plain abdominal X-ray. Give the name of the label device.
IUCD.
Is IUCD, intrauterine contraceptive device. The imaging modality?
Ultrasound.
Ultrasound. What do you see, or what gives the name of mark?
Fetus.
This is a fetus. This is a fetus. What is this part of the fetus?
The abdomen. I don't know.
Yes.
Abdomen.
The posterior. This is the posterior. تخيلين شكله كيف؟ وكأنه نايم كده عليه. This is the back. So what is this?
Spine.
Vertebrae.
Yes, this is the spine. Yes, vertebrae. And this is the abdomen. What is this?
The legs.
Femur. Femur, yes. And what is this?
The head. Cephal.
Yes, this is the head. And what is this?
Yolk sac.
Placenta.
Placenta. Yeah.
Yeah. This is placenta. Are you sure?
Amniotic fluid.
Yes, this is amniotic fluid. Excellent. Because any fluid appears tag, anechoic. This is amniotic fluid. Placenta is here. This is the placenta. Soft tissue. This is a soft tissue placenta. لكن soft tissue حتى abdomen or placenta. This is the amniotic fluid. Amniotic fluid. This is the modality is ultrasound, and this is the intrauterine fetus. This is the fetus. This is the fetus. Gives the name of the used imaging modality.
CT.
Yes, بس من cross section and CT or MRI to know which one is this. Look to the bone. مثلا this is the spine or the pelvic bone, very dense. تعرف إنه this is a CT. What is this? Causes anterior.
Renal bladder.
Bladder, yes, exactly. And what is this?
uterus.
The breast. Yeah, uterus.
So this is the uterus. Renal bladder. طبعا حنسألكم من uterus لكن بس for the sake of the knowledge نديكم أسئلة ثانية. But this is the contrasensitive valve. What is gives the name of the use imaging modality? Yes, Arthur. X-ray. Yes, CT. Which plane? Is it coronal, sagittal, axial? Which one?
Sagittal.
Sagittal. Thank you. These are the spine, posterior, and this is the anterior. So, give the name of the label organ. A. Label organ. A. Organ.
Uterus.
Gives the name of the layer, uterine layer marked as A.
Myometrium.
Give the, yes, thank you. Give the name of the uterine layer marked as P.
Endometrium.
Yes, thank you. Give the name of the used imaging modality.
MRI.
MRI, which plane?
Sagittal.
Sagittal.
Which?
Axial.
Yeah, sagittal. Axial بتكون شنو؟ dividing the body into superior and inferior. لكن sagittal dividing the body into left and right. أنت كأنك بتنظر من الجانب. This is the sagittal, as your colleague said. Which sequence? سؤال advanced شوية لكن which sequence is this? Sequence الألتراساوند عندنا حاجة اسمها T1, T2. These are the common sequence. Which one is this? قلت أثناء المحاضرة.
T2.
Yes, why T2? نعرف كيف إنه T2. دائما نحن نعرف الCT والMRI by looking to the bone to differentiate between T1 and T2. Look to the fluid. Fluid in T2 appear very bright. يعني بسموه hyper intense. لكن in T1 بيكون العكس بيكون أسود hyper intense. أنت تحاول تشوف وين الفلويد. مثلا this is urea bladder. لقيت اليورين bright hyper intense تعرف إنه this is T2. طيب again give the name of the organ marked as B. Organ.
Endometrium.
Uterus.
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 Give the name of the layer marked as A.
Myometrium.
Myometrium.
Yes, and the uterine layer marked as P is
Endometrium.
endometrium. The endometrium يتذكروا إنه دائما بيكون hyper intense. نتكلم في لاحظوا الترم قلنا hyper intense in T2. The endometrium will be hyper intense. Give the name of the imaging modality.
MRI.
Yes. Which plane?
ما ادري.
coronal كأنك بتنظر للشخص وهو واقف أمامك. coronal. Which sequence?
T2.
T2.
Yes. Yes. Urine appear hyper intense. طبعا عرفتوها MRI ما CT لأنه أنا نلاحظ الهيد اوف الفيمر not very dense ما أبيض مرة أصلا ممكن يكون جراي أو black. طيب و give the name of the structure marked as A.
Ovary.
Ovary.
Each one we have two ovaries.
Right.
Left. Right.
Always
Right.
this is the right and this is the left. But this is the right ovary, so this is the left ovary. The organ marked as P.
Uterus.
Uterus طبعا معروف this is the urinary bladder. MRI coronal. If you have any question, you are excellent.
دكتور I have a question.
Yes, welcome.
كم سؤال في الاختبار؟
I don't know. أنا بعطي أسئلة كثيرة هم بيختاروا معي sometimes 2 question تلقائي بغيتها I don't know لكن not less than 2 sometimes 2 لكن you can ask the organizer يعني
اوكي
Sorry.
شكرا دكتور.